seniors in your 60s and approaching 65, did you know that you will have to pay a monthly premium for Medicare Part B if you do not terminate the coverage? That is correct. So when you get on Medicare, and if you are already receiving Social Security, you are automatically enrolled in Part A and Part B for coverage. Part A is hospital insurance and Part B is medical insurance. And do you know how much that costs? Part B costs around $185 a month, whereas Part A is free. As we know, though, nothing is actually free in this life. But Part A is for hospital insurance and Part B is for medical insurance. So if you do not need Part B and you have good health care insurance already, terminate it. Now, in order to terminate the process, you will need a form. It is called the CMS-1763. Now, you will have to contact the Department of Health and Human Services to get this form, and if you need some assistance in filling out the form, you can contact them at the 888 number. Again, this is for individuals who are already collecting Social Security. You are automatically enrolled in Part A and Part B for Medicare. Part A, again, is hospital insurance. Part B is medical insurance. Now, there are some of you out there who love coverage. You want additional coverage. Then you may want to also add Part D. And you may want to keep Part B alongside your current insurance, where you're covered, over-covered, and some people like it like that. Now, if you want to save around $185 a month, then you want to terminate this whole process for Medicare Part B. Now, what you want to be doing is keeping your eye out, looking for this big envelope from the Department of Health and Human Services. Now, before you turn 65, because that's when Medicare starts, you're going to get bombarded with all kinds of literature, all kinds of brochures, different agencies and companies sending you mail, asking you, to reach out to them, or a free dinner. Some of them are giving free dinners to come and sit in their retirement programs to learn about those things. Quite welcome. You can go. But the one piece of mail you don't want to miss and you don't want to toss is that big white envelope. It's about a 5x7 size, and it'll be from the Department of Health and Human Services. Now, to complete a termination form, because the first envelope is letting you know that you enroll, but the termination form is a separate form. Now, you may need your family assistance, you may need an attorney, can't say you do really need an attorney, or you may need some additional support in completing that form. Now, you can call the 888 number or the 800 number and they will give you assistance. Now, be patient because the lines are very busy and lots of people are calling in. Now, you can be patient and wait a good long time on your phone, or you can lock in the phone number from which you are calling from and secure your spot, and they will return your call. A representative will call you back. So, and that works. So, say for example, you leave your phone number and want them to return your call back, and they say your call is 90 minutes. Well, that 90 minutes could very well turn into 180 minutes. So don't fret, because the government will return your call. I remember my mother used to tell me, she said, the government is slow, but it is sure. The government is slow, but it is sure. So reach out to someone for some assistance if you need help to complete this form, the CMS-1763. And I will put this information in the description so you can check that out. I'm not your final authority. I'm just here to give you some good, solid information and help you save some dinero. Hope you like this video, and like and subscribe and make a comment. Let me know how old you are watching this video. Are you 60? Are you 64? Are you a senior citizen at all? Or are you a family member watching and looking out for your senior citizen in your family? Thanks again for watching, and you have a great day.